All right, let's jump right in. If you're in medical school or residency, you absolutely have to be able to spot hypothyroidism from a mile away. Today, we're going to build that classic clinical picture from the ground up, starting with the basic problem and taking it all the way to its most common cause. So, let's get to it.
To really truly understand hypothyroidism, you have to be able to answer this one simple question. Because honestly, every single sign, every symptom we're about to cover, it all comes back to this one core idea. So what exactly is this hypometabolic state? Here's our game plan for today. We're going to start by nailing down what that hypometabolic state really is. Then, we'll look at the clues you can actually see on the outside, the skin, the hair, the face. From there, we'll dive inside to see the systemic effects, and we'll finish up by unmasking the #1 culprit, Hashimoto's thyroiditis.
Okay, let's get into our first section. I promise, if you can really wrap your head around this core problem, that long list of symptoms you have to memorize suddenly becomes super intuitive. This is the why that connects everything else.
It really just boils down to two main things going wrong. First, without enough thyroid hormone, pretty much every process in the body just slows down. Think of it like all your cellular machinery is stuck in slow motion. And second, you get this buildup of these spongy, water-loving molecules called glycosaminoglycans, we'll just call them GAGs, in all your tissues, and they pull water in with them, which causes a very specific kind of puffiness.
The best way to picture this is to think of the body's battery just running on empty. Everything is underpowered. This gives us that classic, unforgettable mnemonic for hypothyroidism. The patient is cold, slow, and puffy. Burn that into your brain.
And this translates directly into what the patient tells you. They're going to feel this deep fatigue and weakness. They can't stand the cold because their internal furnace isn't generating enough heat. They might notice some weight gain. But, and this is super important, it's mostly from that fluid and GAG buildup, not a huge amount of fat. They'll also complain of that classic brain fog, and yeah, their gut slows down too, leading to constipation.
Okay, now let's see how all this stuff on the inside starts to show up on the outside. These physical exam findings are incredibly high yield, both for making the diagnosis in the clinic and for crushing your board exams.
So let's sketch out what we call the classic myxedema face. First, you're going to see this puffiness, especially around the eyes. That's periorbital edema. And it's a non-pitting type of edema, all thanks to those GAGs we talked about. Next, here's a huge clue. You'll notice the loss of the outer third of the eyebrows. That has a name, Queen Anne's sign. And finally, their skin might even look a little yellowish. That's carotenemia, because the body isn't able to convert keratin into vitamin A properly.
And the skin changes don't stop at the face. The skin all over becomes dry, really coarse, and cool to the touch. That's because of decreased blood flow and sweat glands that have just kind of shut down. The hair also gets coarse and brittle, and patients will often complain about losing hair all over. Even their nails can get brittle. It's a total system-wide effect.
Okay, so we've seen the outside. Now let's take a look under the hood and see how this hypometabolic state is messing with the major organ systems on the inside.
The cardiovascular system really takes a hit. You'll see the heart rate slow, way down, that's bradycardia. But here's a really important point. While the heart's output goes down, the resistance in the blood vessels actually goes up, and that often leads to diastolic hypertension. These patients can also develop fluid around the heart, a pericardial effusion.
And the gut? Well, like we mentioned, it just slows to a crawl. This decreased motility is a direct result of that metabolic slowdown, and it's exactly why constipation is one of the most common complaints you're going to hear.
Now for the neuro exam. There is one classic can't-miss physical finding. It's the delayed relaxation of the deep tendon reflexes. We call it Woltman sign. You tap the knee, the leg kicks out, but then it just seems to hang there for a second before it slowly comes back down. It's a total hallmark. Oh, and also, remember that carpal tunnel syndrome is really common, probably from GAGs getting deposited in the wrist.
And just to round things out, here are a few other high-yield points. In women, you'll often see menstrual problems, classically menorrhagia, which is super heavy periods. Muscle aches and cramps are really common, and you'll often see an elevated creatine kinase, or CK, on their labs. And lastly, you might find a mild normocytic anemia, and you should always remember that there's a strong link to pernicious anemia, which is another autoimmune disease.
Okay, so we've seen the what. We know all the signs and symptoms. Now for the last piece of the puzzle, the who. What is the main villain behind primary hypothyroidism in most of the world? And the answer is Hashimoto's thyroiditis. It's a chronic autoimmune condition where the body's own immune system basically declares war on the thyroid gland.
Lymphocytes invade it and just slowly destroy it over time, leading to a gradual failure to make enough hormone.
So how do we prove it's Hashimoto's? Well, the key is finding specific autoantibodies in the blood. The most important one, the one you really need to know, is the anti-thyroid peroxidase antibody, or anti-TPO. It's positive in over 90% of patients with Hashimoto's. You might also see anti-thyroglobulin antibodies as well.
What's interesting is how the thyroid gland itself changes over the course of the disease. Early on, all that TSH stimulation from the brain and the inflammation from the immune attack actually makes the thyroid swell up, forming a firm, rubbery goiter. But over many years, as the destruction continues, the gland eventually gets scarred down, fibrotic, and atrophic, and it actually shrinks.
So, to wrap this all up, here is your money slide. This is your takeaway. Remember, cold, slow, and puffy. On your exam, look for those lost outer eyebrows and check for those classic delayed reflexes. And when you see that whole picture, the first thing you should think of for the cause is Hashimoto's.
So you did it. You identified the whole clinical picture and its cause. Fantastic. But the story doesn't end there. Before you even think about writing that script for thyroid hormone, what critical metabolic changes, things like how the body clears drugs, do you need to think about to make sure you treat your patient safely and effectively? We'll leave you with that.